Before we begin, we'd like to give special thanks to all of our sponsors for making this event possible each year. Specifically, thank you to CRL FormFox for being our title sponsor for 6 consecutive years. And thank you to our platinum sponsors, Psychmedics, OraSure Technologies, Quest Diagnostics, and Veriforce. Hello, and thank you so much for joining us for another session of Day with DISA. Today, we're talking about violence in the workplace, and we're joined by Kim Olszewski, former president of the American Association of Occupational Health Nursing and DISA's Director of Medical Services. Kim, how are you doing today?
Doing great, Thomas. Thanks for having me.
Yeah, we're excited to have you. So before we jump into the presentation, I do want to remind everyone, if you have any questions, use the Q&A button at the bottom right of the player. If there's any questions we're unable to get to today, we'll reach back out to you after the conference. Additionally, we'll make a copy of this presentation available for download in the Materials tab after the session. With that being said, Kim, the floor is yours.
Thank you for that introduction. And we're going to spend about the next hour reviewing a lot of information on workplace violence and workplace safety. And there'll be a lot of takeaway information that you can have. The objectives for this presentation will be to review statistics and current trends related to workplace violence. We're going to talk about some strategies to identify and eliminate workplace violence in the healthcare setting, but also in all industrial settings, not just healthcare. We're going to identify some potential workplace violence situations and talk about some case studies at the very end. And finally, we're going to review some best practices for development of a workplace violence policy. So let's start out with some basic definitions. And some basic definitions of workplace violence is it's an act or a threat of physical violence, harassment, intimidation, or other threatening disruptive behavior that occurs at the work site. It can range from threats to verbal abuse to physical abuse and ultimately even homicide at its worst. It can affect and involve employees, clients, customers, and visitors. And I just want you all to take a couple minutes here and just reflect on your workplace or your past experiences and think about a situation that potentially could have gone violent or did go violent and how you responded. So today's presentation is really going to have you be looking and thinking about some potential opportunities to mitigate an episode of workplace violence in your institution and some meaningful tools to help you implement within your organizations as you move forward. So first, let's look at what are some characteristics of risky situations. So we have a lot of different topics and a lot of different characteristics that can fall under this. But imagine this, imagine the workplace bully. I think we all know what that means. And they're the ones that are the intimidators, they're the bad actors, they have bad behaviors, but really nobody wants to address that workplace bully. We have disgruntled employees. They might believe that they've been treated unfairly, they've been wronged, the organization is to blame, and they want to get back at their employer for what has been wronged to them. We have those employees that overly attach within their workplace. Perhaps that's their place of socialization. They have a hard time going away. Their job's their identity. They maybe don't have many friends or family and use that institution or organization as their means of socialization. They feel betrayed that now that maybe they're not part of that organization, that took away their social system. And then finally, they get to that point of desperation where there's nothing left to lose. And they get into that emotional distress. That could be over divorce. It could be over something at work. It could be a recent death or loss of life. So there's many different characteristics that can lead someone to quote unquote breaking or that breaking point when something potentially could happen or will happen. And unfortunately, again, if we all reflect and we think about what's going on in the world around us, what's going on perhaps in our families, our jobs, everywhere, there are some situations that have the potential, and we train for this to make sure that we can mitigate these problems. So when we look at statistics, so the Bureau of Labor Statistics, the most recent data that I could come up with, they did not release the 2023 information yet, but in 2020, the statistics are actually quite alarming. There was 392 homicides, and about 37 and 69 fatal injuries. And those are just the ones that are reported. So think about all the ones that are not reported, and that would significantly increase both of those numbers. And ironically, as they look at the job categories and what job classifications would potentially increase those statistics or have a higher rate for workplace violence would be in sales, and they account for about 23.5% of homicides. And again, these statistics are from the Bureau of Labor Statistics, and as of today's presentation, the newer data has not been released past 2020 that I could locate. So this slide was actually designed to be a test. And, I'm in education as well. And, I like to quiz and make sure that information is being retained. But this information here largely came from SHRM, the Society of Human Resource Management. And I'll go ahead and give you the answers and tell you that all of these are true. These are true statements. So the first one here, if we look at workplace violence causes businesses to lose $250 to $330 billion on average per year. And that's absolutely true. According to Forbes, those losses are due not only to lawsuits and legal action, but to injuries, decreased productivity, and even damaged reputation. So, there can be a loss of customers through that. So there's a large price tag that goes along with workplace violence issues that may occur in or around your workplace. The second is approximately 1.5 million workplace assaults occur every year. And as I mentioned in the slide before, many go unreported. So if you think about all the assaults or robberies or even rapes that go unreported, those numbers would even be higher. So 1.5, I think, is a conservative number. I think that number is higher. Number three, 24% of employees are aware of workplace violence incidents in their organizations. The SHRM survey that was referenced for this data point says that about a quarter of a workforce knows when something happens in the way of workplace violence. 14% know that an event maybe occurred, but maybe do not know the details. And 19% just clearly aren't unsure. They aren't unsure what workplace violence is and what happens within their workplace. Moving on to number four, workplace violence statistics show that 251 fatal work injuries happen due to violence. It also shows, it does occur to violence, but it also shows that the age group of 55 plus is the most common age group in which these injuries occur. Number five, 45% of American workers are aware that workplace violence prevention programs exist at their companies. Again, SHRM is where I went for this data point, and 71% felt pretty confident they know what to do, but I'm more concerned about the 29% that were unsure and really didn't know what to do in the event something happened. And that's really the group we want to target with this information. And then finally, 41% of registered nurses are victims of bullying, incivility, or other acts of workplace violence. And I pulled out this statistic because largely we all deal with healthcare in some fashion, but healthcare is a huge industry that there is a lot of lateral violence and lots of workplace violence issues, patients to providers, other nurses to nurses, what have you. 27% of the healthcare surveyed members said that they witnessed workplace violence. 10% felt that their organizations addressed it appropriately. And 63%, again, another concerning statistic, said that they felt that their organizations did not respond at all. So think about not only, these statistics that I just shared, but think about what potentially the pandemic did to these numbers. We talked about the pandemic having people working from home and the increase potentially of, domestic violence because they were home more and didn't have a way to get out of that environment. But we do think that COVID had a significant impact on workplace violence statistics and numbers. So who's most likely to be part of a workplace violence situation? And we talked about a couple already, and I'm just going to add in a couple more. The first group we're going to talk about is, the job type or the job group. So those in healthcare, as I mentioned, are at higher risk, largely because, years ago I did home health nursing, and, it was thought that, we were at higher risk as home health nurses because our patients or the public thought we were carrying medication. So if they think that you're carrying medication, that puts you at an increased risk. So healthcare is high on the list. Veterinary clinics, again, because of the medication use, that's another concern. So that is on the list of one of the tops. And then as we move through, we have correctional officers, police, teachers, municipal inspectors, retail workers, those that sell alcohol, and any of our public transit. So if we think about taxi, Uber drivers, those are another concern, and those that work in the banking industry. So think about transportation and all the work that we do with the transportation industries. Think about how they may be impacted, and we're going to talk about that a little later on when they work alone and what potentially increase their risks. So next we move on to the location. And as you can imagine, those working alone are at higher risk. And, I read an article in preparation for today, and, we're going to talk a little bit about how to set up a work environment. But, the article was from Harvard, and it stated, how private is private? And, are we setting ourselves up for a situation where perhaps we're at increased risk for violence? But again, those working alone, those that handle money, mass transit, public transit, those working in the public, think about convenience store workers tend to be part of a population that's at higher risk. And whenever there's some type of intense organizational change, think about a strike, there's always increased risk at that point as well. So if we look at times of the years, there are times of the year that the risk is higher. Late hours is certainly a concern. Working alone, tax return season, we're right in the middle of tax return season. That's at a higher risk. Holidays, paydays, when your report cards are coming out. So think about our adolescents and our kids in the school systems, and perhaps that's stemming, some of these issues we're seeing in the school systems. Performance appraisal time is another concern. Car repossession time. If you're overdue for your utilities and perhaps your electric or something is being cut off, these are just some scenarios. There's a lot of different ones out there, but these are the areas and the concerns that put you at higher risk for workplace violence. As I mentioned, I have a lot of resources kind of embedded into this presentation, and this particular resource is from the U.S. Department of Homeland Security. So if you go to that website, there's a lot of great resources on here. And this is a great starting point as you start having those conversations with your employees and start talking about training sessions. So if we look down through here, these are indicators that a lot I just mentioned, but some potential for violence by an employee. So if you think about, their behaviors are changing. You saw a change in personal hygiene, maybe a change in their absenteeism, little more withdrawn, just not themselves, their behavior's just not off, they're paranoid. These are all things that, you working side by side by your workers, their personalities, kind of their interactions that they have with you on a regular basis. And largely those employees are going to be the first to notice that something just isn't quite right. So this is just a nice little review to look over on some indicators that potentially could lead to some type of a workplace violence situation. So moving back to terminology, and as I move through these slides, some of these I already talked about on definition, but I'd like to just review them again as we move through. So let's look at the first one. The first one is workplace violence. Again, act or threat, can be intimidating, can be an actual behavior, and it can be a threat of a behavior. So workplace violence is a lot of different things, and we have examples with these, school shootings and mass shootings. That's a classic example of workplace violence. The workplace bullying, as I mentioned, it just might be those words or mistreatment, or it can be physical, it can be emotional, but it's mistreatment that is not warranted and certainly not received by the recipient as being appropriate. And that can be from peers, subordinates, what have you. And I've had some people talk to me about workplace bullying where they're just not collaborating, and they're not working together well in their work environment, and they just are. And even it goes as far as social media. So you can see a lot of that on the web. Incivility, that's deviant work behavior. Discourteous, impolite, rude are all words that you might hear with that. There's actually lots of work and research being done in nursing specifically. That's my background, so I know a lot about it. But there's a lot of work on incivility within nursing, and a lot of companies are moving towards having a healthy workplace environment team, which will help address those behaviors and have a mission that states we're not going to allow this or accept this type of behavior in our workplace. So incivility is a huge issue in healthcare. Cyberbullying, I mentioned a little under workplace bullying, but it is those offensive emails, memes, texts, social media, things that are unwarranted and not welcomed are considered cyberbullying. We have mobbing. Mobbing is when it's bullying by groups or individuals. And, I think about, what happened with those, mass robberies where they would, go into stores and mob them and steal them, or even what happened at the Capitol within our own federal government. And when they stormed the Capitol building, that was a mobbing situation. That was a violent situation. And then lastly, there's lateral violence, and that's where it is a horizontal violence organized and with harmful behavior. And a lot of times that's construed as like a hate crime. So again, more definitions as we move through. So shifting over now to talk about, types of workplace violence, and NIOSH does a great job of looking at 4 different types. And I'm going to add a 5th type because some of the literature does talk about 5 different types of workplace violence. First being criminal intent. You can read through the definitions as I go, talking about recent like store robberies, as I just mentioned. We saw a lot of the news in California when there was a lot of smashing of the windows and grabbing and going. Those are criminal intent. Customer to client, I have an example here personally. I'm a nurse practitioner, worked in occupational medicine for 32, almost 33 years now. And, in the healthcare setting, I had a patient when I was doing a physical. And as you can imagine, when you're doing a DOT exam and you decide that the driver is not qualified to drive, that's a life-changing event for that driver. And I don't take that lightly. I had a patient come off the exam table after me and actually corner me in the side of the exam room, threatening me because I just took away his livelihood. So that would be an example of a customer and client situation. Then we have worker on worker. We see lots of, examples of where, a worker felt that they were wronged and came back into the work site and caused some type of a violent situation. We hear about those. Those are the ones that make the news, unfortunately. Then we have, personal relationships that maybe get brought into the workplace. And that personal relationship might be a spouse, a significant other, someone that comes into the workplace and decides to address the issue with that person at their work site. So that would be more or less a personal situation. And the last one that I said in the literature that I'm seeing for type 5 is that ideologic violence. And those are, those political extremists. And I just used the Capitol as one of those examples. But anyone that has an extreme view and then it carries on into a violent behavior, it's labeled as ideologic violence. So again, that would be a type 5. And what I'm seeing in the literature is it is recognized as a type 5. So looking now on some preventative measures, and, I just recently mentioned, I was in an exam room and the patient came off the table and had me cornered. Well, that certainly led to redesigning the configuration of that exam room, because workplace design should be that I can easily remove myself from that situation if at all possible. So you can believe I looked at furniture and how those offices were organized. But when you think about workplace design, it's not just the furniture, but it's installing cameras. It's physical barriers. Perhaps you have, a receptionist area and they need a bulletproof window. We used those barriers when COVID came for, bloodborne pathogens and for pathogen spreading, but really we need to think about even for weapons and bullets. You want to minimize the number of, entrances into your building if at all possible. So you want to control that. And if you can control it with some type of card access or key access. One of the shootings that was in the Texas area, I guess it was about a year or so ago now, someone propped the door. And that's how, the person got into the building and did the shooting. So think about your doors and access to in and out of that area. Again, positioning of office furniture is key, and think about your interior and exterior lighting sources. So those are all things, just basic things to consider in workplace design. From an administrative perspective, you want to think about making sure, this is something basic, and you'd have to think about this with your HR, but making sure that your performance evaluations are fair and transparent. If your employees are surprised, so to speak, those are the ones that potentially can have that workplace kind of retaliation because they were not expecting it, or it impacted a raise, or it impacted a promotion. So be sure you're very transparent with your evaluations if you're a manager, and make sure you're giving that feedback, all along to your employees. You want to make sure if you're traveling, even remotely, use the buddy system as much as possible. Strength in numbers is what they say is most helpful, and that certainly is best, if at all possible, to have a buddy with you. You want to have a designated contact. You want to make sure you're checking the credentials of people coming in and out of your building. Perhaps you have someone that manages the visitors at your facility. That's really important to make sure that they're, expected to be there, and they're credentialed to be there. And, overall, just don't put yourself in unsafe situations. And I think that goes to say that, if the situation does not seem correct, you want to make sure that you mitigate that problem. Some administrative practices also is, low cash on site, locking up your valuables, good education and training, and certainly how to teach your employees to respond. So looking at some strategies, we want to look at preventing, all of these, and we're going to kind of walk through these, but analyze your workplace. What are your employees telling you? And, what is really going on in your work environment? That's really important. And to do that needs assessment. And I have a simple needs assessment within this presentation that you can utilize. You want to make sure you have a real supportive environment. And again, the one article that I just read is a comfortable environment. The employees need to feel comfortable. Open door policy. And they even talk about, the office cubicles shouldn't be cubicles anymore. They should be glass windows that there's no thoughts of what's going on behind that closed door. Are they talking about me? There's probably some pluses and minuses to that, but that's, again, in that article that I just read from Harvard, that they said, make the environment that is very transparent, and that there's no perceived secrets going on behind closed doors. You want to offer communication and empathy training. There's a lot of web-based trainings out there. There's a lot of free trainings out there in OSHA on the website that you can utilize. You want to make sure you have a clear established policy. You should have on-site counselors available should there be, some significant situation that they need to be, debriefed. And a lot of times your EAPs can work with you on that. You want to commit to a nonviolent workplace. And again, that starts from the top down, and really saying, we have a supportive environment, and we want to address any problems as they occur. Training, again, training just not on workplace violence, but substance abuse, recognize of substance abuse. Perhaps you have a substance abuse policy that you have. That would be a good time to kind of piggyback that training on. As far as violations of company policy, what happens if that occurs? And lastly, that action plan, and I read this other example that I'll share. In the 50s, in the 1950s, we were drilling for nuclear attacks. And I remember that because I live close to a nuclear facility here in Pennsylvania, where I'm located. But now in the 21st century, we have to do active drilling, or active drills for active shooters. So we simulate that in many different areas, what to do and how to respond. Again, this is another Homeland Security site reference that I pulled up for all of you. It's pretty difficult, and I'm not going to read through all of this. Again, it goes through the different, NIOSH types of workplace violence. It talks about a little bit of bullet points underneath it. So this is, again, something that you can hand out and give to your employees, or post in a prominent area for them to think about. These are some high alert situations that can lead to something, catastrophic ultimately. So how do we respond? That's the big question. And we spend a lot of time analyzing after the fact, or, we hear that with accident investigations, and we talk about, what were some of the cues? Did we miss a cue? What were some of the things that we could have identified early on to perhaps prevent this? And we do that within our accident investigations, and we learn from what has happened in the past. But we need to talk about, all of these different areas and how to respond. So we'll talk about active shooters next, and what to do with that. But if you've come across an employee that is suicidal, obviously they're in a point of crisis. So, get with HR, get with your EAP, have them address the situation. If you identify something as an employee, it's best not to go at this alone and try and work with that person one-on-one. You want to work with the professionals that are trained to do this. So your EAP is a great place to start. If it's a domestic violence situation, I'd give the same advice. Work with, getting that person to the EAP, get them the information, it's confidential, and assure them of that. Say this, this is a resource for you that's confidential, and we encourage you to, to utilize that to make sure that they have the resources that they need. And HR would be a really great, place for them to start if they feel comfortable doing it. If you get a bomb threat, we still are getting bomb threats. As of last week, we were still getting them in Pennsylvania here at some schools. There was a rash of that. Bomb threats, you want to keep them on the line. You try not to let them hang up so they can trace it. A little more difficult now with cellular phones. It's not like it was with the days with landlines, but you do want to keep them on the phone. Certainly, you don't want to take the matter in your own hands. If you do see a package that's consistent with what you think is an explosive, 911 is where you want to be and evacuate the area. Again, anything, that does not look right, you need to report it. Just like we do when we go to the airport and they tell you, don't be afraid to say something. That is the case in the work environment as well, because you're the one, again, most, intimately involved with your coworker. And I mean that in a way that you know them from their behavior. You spend so much time with them. More so, 8, 10, 12 hours a day, their habits, and you can tell when something's wrong. So as I mentioned with active shooter, again, this is, the basic premise of run, hide, fight. And the top image right there shows, the door stoppers that were put into place largely after a lot of these mass shootings that you could lock in place, specifically in a school and academic setting was largely what they used. And, I've been doing these presentations, as Thomas mentioned, with AAOHN and I traveled a lot and did a lot of presentations. And one thing that stuck with me years ago, I traveled with a colleague that did a lot of presentations as well. And she came and her and I actually were staying in the same room for one, event that we were at. And she had one of those rubber door stoppers, those little wedges that we all use to hold our doors open. She travels with one. And I asked her, I'm like, why do you travel with that? And she puts it reversed on the inside the door as a means that if someone did break that door in or unlock that door, that it would be stopped with that door wedge. I say that because that was something that she picked up from, a safety conference somewhere for personal safety when she was, a female traveling alone in a lot of remote areas at late at night, and was in places and staying where she wasn't necessarily familiar or comfortable. And that was something she adapted. So again, put things in place and think about, how you can mitigate that. But the steps are run, hide, fight. So if you can escape. If you can't, barrier that door as much as you can. Push your desk in front of it, whatever you need to do to block that door. And ultimately, if you're faced in, face to face with that, you want to fight. Okay, now we're going to move on to some tools. As I mentioned, assessing your workplace is really key. And this is a very, very simple tool. I found this online. There is a resource that I found from actually the state of New Jersey that had a really good training session and a really good list of quick tools that you can implement. Again, there's many out there. I'm not endorsing anyone in particular. OSHA and the CDC have a lot of great references. But again, this is something I found very simple. Yes or no? You can go through and do a quick workplace violence assessment in your facility. Asking you if you have, a policy in place, asking you, do you do training? What happens if there's a threat? Do you have a team in place? So going through and putting yes, no, or not sure, and informing your team, which is what we're going to talk about here in a few slides. But this is a quick way to get a quick pulse on where you are with workplace safety. So again, many out there, and you may have something already in place, but pull this out, not just once a year just because you have to, but a couple times, because we all are changing. Companies are building and expanding their work sites. We're working remote. We're working, all different ways. This needs to be pulled out every couple of months and looked at to say what's changed and what needs to change as a result of this from our workplace violence assessment. So I think I skipped a slide. I did. Okay. So if I look at here, we're going to shift from NIOSH now over to OSHA and look at what OSHA says. So if you remember, NIOSH told us what the different types of workplace violence are. OSHA tells us what the 7 elements of a good workplace violence prevention program should entail. So each of these, we're going to go through them. It should have a policy well-written from your company that is, endorsed by your management team and implemented all the way down. So it should be clearly written, and you should have a policy. You should have a team in place, and that team might be a spin or a little tentacle off of your safety team, but it's your threat assessment team. And, it should be comprised of, multiple people within your organization: security, safety, unions, your floor workers, your administrative people, your front desk workers. It should be a very diverse group of your employee population on this threat assessment team. You should be doing that threat or hazard assessment, as I just mentioned. You should have workplace controls into place, as we talked about already. You should have a training program. And, again, incident reporting is key, making sure people are reporting those incidents so you can have a plan to mitigate that problem in the future. Or unfortunately, it gets to a point that something did happen, it's then an accident investigation, and you're determining what the root cause was and how to prevent it. And finally is your record keeping. So as you're looking at developing a policy, these are some key points, and it needs to be clearly written, and it needs to be conveyed, and the employees need to know where to go for it. So if I walked into your facility and I said, what's your policy on workplace violence mitigation or workplace safety, your employees should know where to go to find that. So whether that's on some type of shared drive on a computer, whether that's in, the good old, binder that still sits on our shelves, we still know people do those. It needs to be accessible for all employees to have. And copies need to be made available just like any of our other, OSHA mandated policies. You need to have them available at the employee's request should they ask for them. So as I mentioned, the next part was that team. And, if you're in healthcare, hospital administration is key. But, not just hospitals. It should be any administration. It should be, staff. It should be the frontline staff. Again, union, security, your finance people, your legal or compliance people, and your HR team. It should be a very diverse group. And I'll put a plug in here for occupational health nurses. For those of you that have occupational health nursing, they are an integral part of this process, because ultimately, a lot of times employees will, confide with them first, and they're able to potentially mitigate a problem. So I'll put a plug in there for occupational health nursing as well. But this is a good kind of representation of who should be on, excuse me, that threat team. And as we're looking at those hazards, as I mentioned, you can do that needs assessment, but you need to really be going back and looking what's going on from a trend perspective. And we talk a lot about now informatics and really looking at our data and drilling down that data. You may not have to get that sophisticated with it, but ultimately that's where this big data is going to be going, that we can look for trends. But now we want to just look at our OSHA logs, look at our incident reports, what's been happening, look in our newspapers, see what's going on. Yes, people still read newspapers. Look on our mobile apps, look on the news, what's going on, a trend in the industry. So, largely a lot of you I know are from the transportation industry or the energy sectors. And we know that there's people working alone. We know that there's people working remote. We know that there's people, out on the road, and there's weather hazards and all kinds of things. So we need to look at those trends and determine what is the risk for our population of our employees? So it might just be as simple as, again, starting with incident reports and going from there, but also looking what's going on from a national perspective. What are we seeing, and how, that's how we learn. The recent, airline issue with the door coming off the plane, caused, a root cause analysis was, there was a flaw in the manufacturing of those doors, and, they mitigated potential problems. Same with workplace violence. If we're seeing things happening in the workplace, how can we mitigate it? So look for trends, and then again, communicate with like businesses. So if you're in trucking, talk to other trucking industries. If you're in, manufacturing of sorts, find your like industry and see if you can mitigate these problems. So looking further at, some ways to control, as I mentioned, those swipe cards work really nice, and ID cards, that way, when people are coming and going, who's in the building, who's not, who's allowed in the building, who's not. And think about if you have internal communications. We can use social media for bad, but we can also use it for good. So you can put out a quick tweet, you can put out a quick message, shoot her in the building, take cover, think about how you're going to respond. How's every employee going to hear that announcement? What's going to happen? So think about how you communicate that to everybody. You're going to talk about your security procedures. We want to keep things confidential, obviously, as much as possible, and assure the person when they report it that it will be maintained confidential, because a lot of times people are afraid to come forward for fear that that information is going to be shared, and they don't want to be part of that. So make sure you maintain confidentiality where confidentiality is certainly warranted. Domestic violence, as I mentioned, that's a big one with confidentiality. They're worried that perhaps, information will get out, and God forbid if the employees, both parties work at the same institution, that's really concerning. So again, look for these high, kind of high concern workplace violence areas. And then lastly, is talking about training and awareness. And, many of you may do background checks and clearances for your employees. That's a great way to potentially identify a problem. Another great way to do that is also having a strong substance abuse program and making sure, that you're addressing that piece, because we know sometimes that substance abuse goes hand in hand with a potential violent situation. So again, these are all just ideas for you to ponder, not saying you have to do all of them, but you need to have a plan in place. And again, these are, kind of some quick hits for you to think about. So as we look at training and education, it's, what we need to understand is we need to do training regardless of our level of risk. All employees need to have this training. Training has to be easily understandable, has to be in terminology that they understand, and the appropriate language. So we do know that, we have diverse workforces, and we need to make sure that we are delivering our trainings, whether it's safety training or HR training or whatever the training is. We need to make sure that it's in a manner that they can easily understand and interpret that information. So the training needs to include these different areas, much like any other OSHA policies. It has to be, recognizing the problem. What do you do if the problem occurs? What tools or security devices are in place? How do we respond if something happens? What's the follow-up, and how do we document it? So basic training, like we do for bloodborne pathogens, medical, records training, any of those type of required trainings, this is the same, kind of guidance. Make sure you follow these steps. So after an incident, does occur, God forbid, it may rise to the level of reporting to the police. But, the bottom line is you need to report all incidents, meaning report internally or externally, regardless if there's an injury, because that's where we, again, identify those trends. Assuring confidentiality, as I mentioned, and getting that threat assessment team. But when you do the incident reporting and you need to go through and you do just like you would an accident investigation, you need to identify, what these problems are and how you're going to address them, and then communicate how you're addressing. But, ultimately, the last point is important too. You got to, keep the victims in mind, think about witnesses, think about who's been impacted by this issue if something did happen significant, and make sure that you are following through with that. The record keeping, as I mentioned, like any other program, you keep it on the OSHA 300 log if there's a significant injury as a result of that, or an injury that fits recordability. You want to document your assaults. You want to document any type of aggressive or abusive behavior. That's an incident. So make sure that's documented and kept somewhere. You want to have regular safety meetings and talk about the debriefing from when issues do occur, and look at those trends, as I mentioned, and what's going on. Inspection reports are also helpful. Maybe just that simple walking through the building to assure that all doors were closed and locked would have prevented an injury. I don't know that. But those are something that we can put into place, that all doors were inspected or all computer accessed, badging was, assessed for accuracy. Those are all important documents, as well as our training documents. And, and then obviously we have down further there medical records if you need to from a comp perspective, or the occupational health nurse may have that, insurance, FMLA, those type of things, which largely is controlled by your occupational health department or your HR department. Again, nothing unlike what we see with the other type of OSHA mandated trainings. So I gave you a lot of information in a short amount of time. And before I move into a couple case studies that I just wanted to kind of talk through and answer any questions that are out there, I just want to say that there's a lot of information that's available to you. So if you listen back to this and you thought, yeah, we're doing this, I have this all in place, great, keep doing it. If you don't, these are great starting points. Don't reinvent the wheel. OSHA has a really good list of trainings and educational materials. NIOSH, has a lot of good information as well. Very simple to understand. You can see the bullet points I had here in the slides. Just talking about basic scenarios or basic things to kind of heighten somebody's awareness, but just to give you a starting point. So hopefully you found this information to be helpful. And again, this is designed for not only safety at work, but safety in the public and safety in just going about your daily lives, and how to have heightened awareness and make sure you're safe when you travel on vacation. I have a colleague who was just in, Philadelphia this, over the holiday break, took 10 minutes to go to the, look at the Rocky statue at the art museum in Philadelphia. Her car was smashed in, her wallet and purse was stolen, and, her whole identity was taken. Not directly workplace violence, not directly violence to her, but it was violence against her. And it just shows how quick something can happen. So anyway, I just wanted to, end with 3 quick scenarios, and then I'm going to open it up for questions unless I'm out of time. But I'm going to just talk quickly about 3 different quick scenarios and how that, something impacted their lives. I had a neighbor. The neighbor had a daughter that started a new job. The new job happened to be in special ed and teaching. And the daughter, it was her daughter, said that she went to this place of employment. There was a lack of mentorship, very cliquey at lunches, being told, you should know this because you went to school, because this girl had a master's degree, but it was her first teaching job. Really created that hostile working environment, and, was not inclusive, and was just doing things to really, it was bullying. It was bullying at its finest. And it got to the point where her daughter said, you know what, I can't do this anymore, and ended up quitting. And so she finally, bolstered up enough of her, confidence to go into HR to quit. And they said, you can't quit. You signed a contract. You got to stay here 2 more months. And, the next words were, you can't leave because our community is too small. And I know people. So there was threats and bullying going on from administration all the way down to the employees, and it just wasn't tolerated. And that person left. But unfortunately, they did not have a strong policy in place to address these issues. And again, that was very concerning because it was being handled not only at the employee level, but above that. So that's where that policy is really, really important. The next one was a personal friend who worked as a corporate accountant for 30 years and was being harassed actually by another coworker. The coworker would come in and move items in his desk, would walk by and knock on the door, was just doing harassing, unwanted type behaviors. We talked about that. You know, that's another part of workplace bullying. And, you know, would make phone calls and things that were just not warranted to that employee. Well, the employee finally had enough and went to HR and said, listen, I'm being harassed by this employee to the point that I have anxiety and I just want to retire. And that person, that was swiftly taken care of. But that was a workplace situation where, you know, they were being harassed with little things at work with the point of intimidation to make them retire. The last one I just have is about a social situation. And this happened back in July of 2020. And a middle-aged couple was out. They were just starting dating. They were going through a divorce, each of them. The divorces weren't too cordial. One was really nasty, but they found comfort, you know, in their company. And the lady that was involved in this couple, her spouse was, they thought, tracking her vehicle and following them to different places. And they were at a restaurant eating and came out of the restaurant and car drove up and shot them both dead in the parking lot of this restaurant. That happened to be my cousin. And just goes to show that you can be in a situation or surrounded with a situation where there's domestic violence going on and the injuries that can occur because of that. So again, it can happen in social situations, it can happen in schools, it can happen in organizations, it can happen anywhere. So, you know, be mindful of your resources. And I hope you found this information helpful. And if you have any questions, I'm certainly available to take them now or by email at the conclusion of this presentation.
Thank you so much for your time today, Kim. I know we are really over time at this point, so I think we are just gonna wrap it up here. But thank you for your time today.
You're welcome, and I'm certainly available by email if there's any questions. So thank you for having me. I appreciate it.
Yeah, no, definitely got questions. We'll reach out to all of those individuals next week, and we'll work with Kim to get an answer to those. Again, thank you everyone for attending today. Bye-bye.